Like and subscribe to my channel and click the bell icon to get new video updates.
On its 20th anniversary, to commemorate PEPFAR's success in saving millions of lives in developing countries from the scourge of HIV/AIDS, it has been 20 years since former President George W. Bush launched the Presidential Emergency Response Plan for AIDS, PEPFAR. To date, PEPFAR remains the largest commitment ever made by any country to combat a disease. It has saved tens of millions of lives from the scourge of HIV/AIDS in developing countries around the world. In 2003, the U.S. Congress approved a $15 billion plan for what was originally a 5-year plan to comprehensively combat HIV/AIDS pandemic. In his 2003 State of the Union address, former President George W. Bush called for a work of mercy for HIV/AIDS victims in Africa and the Caribbean, committed an unprecedented amount of resources to fighting HIV/AIDS. The act, officially known as the Leadership Against HIV/AIDS, Tuberculosis and Malaria Act in 2003, ushered in an era of hope for the HIV/AIDS affected regions from the Congress in September this year. The total of $110 billion includes funding for the Global Fund to fight AIDS, tuberculosis and malaria, of which the U.S. government is the largest donor. Annually, the U.S. government spends $13 billion on global public health, of which about 42% goes to HIV. The success of PEPFAR is due in large part to dramatically improving patient access to life-saving antiretroviral drugs. In the period from 1995 to 2015 alone, it is estimated that ARV drugs prevented 9.5 million deaths worldwide. Additionally, these drugs resulted in an economic benefit of $1.05 trillion. For every $1 spent on ARV therapeutics, $3.50 in benefits worldwide increased viral suppression from 80% to 95%. PEPFAR-funded treatments can also prevent transmission of the virus to sexual partners through pre-exposure prophylaxis and reduce the risk of mother-to-child transmission of HIV. In its first 15 years, the PEPFAR program reportedly enabled the birth of more than 2.2 million HIV-negative babies to HIV-positive mothers, facilitated prevention through 15.2 million voluntary male circumcisions, and reducing infection rates.